Frequently, I feel that I have fallen through the cracks. I haven't had the attention that I thought I should.
For 79-year-old Maureen Matheson, it's a daily struggle as she deals with numerous chronic health issues.
Since I turned 70, it has gone down the Swanee. Not good. And it won't improve.
Maureen lives in the town of Moonta in regional South Australia, where GPs have come and gone, making it hard for her to have a regular doctor. Last year, Maureen's chronic back pain flared up and she was forced to travel more than 2 hours to the emergency department in Adelaide.
The only way I was going to get treated was to appear in casualty and say, "Help," which I did, and the doctors were not impressed. However, they did admit me. And I was in for a few days, and they were doing tests. And then my abdomen started to swell. I queried it because nobody else seemed to notice it except me.
Not only did doctors find internal bleeding, but several other serious conditions that hadn't been picked up. Maureen had to remain in hospital away from home for a month.
I do remember saying, "Lord, if you're going to take me, please do it now." However, he declined, and I'm still here.
The hospital system is under pressure from patients with complex conditions. Patient advocate Dorothy Kamika says that people like Maureen wouldn't end up in hospital if they were better cared for in the community.
When patients ring me, they are very often in trouble, and when I think that their symptoms are not being dealt with properly by their doctors, they don't have access to those doctors, then I would tell them to go to an emergency department. And I would think since the beginning of this year, I am probably telling about one client a fortnight to go to the emergency department.
Good on you.
Good to see you.
With less than 2 weeks until polling day, medical groups are underwhelmed by the lack of big ideas on offer.
I think the major political parties are scared about health reform. They think it's expensive, they think it's difficult, and they think it's probably politically unpalatable.
The system is simply jammed up from the back door to the front door, and something has to be done to address this.
We're really looking for more than Band-Aid solutions. We're really looking for big picture structural reform. You know, over the last decade or so, billions has been taken out of primary care and general practice. And now we're seeing, you know, what they call an acute crisis, but really it's a slow degrading of community-based level of care.
Among the election promises, the Coalition has pledged $146 million to increase the number of doctors in the regions, while Labor has promised $135 million for 50 new urgent care clinics. Both parties have committed to cheaper medicines on the PBS and to expand eligibility for the Seniors Health Card. While medical groups have welcomed these promises, they say it's not enough to clear the bottlenecks in the hospital system.
The hospital system at the moment is the most dysfunctional I've ever seen it in 20 years of working in it. There's a lot of focus on ambulance ramping and hospital overcrowding at the moment in the media, and it's been presented as if this is a problem with COVID, but actually this problem has been building for years.
Labor argues its urgent care clinics will ease pressure on hospitals. Based on a New Zealand model, these clinics treat patients with urgent but non-life-threatening conditions.
Cuts, penetrating injuries, the non-life-threatening ones, minor eye injuries. So they're the type of injuries that we deal with.
Urgent care clinics already operate in some states, like this one in South Australia. Dr John Adey is the Australian convener of the Royal New Zealand College of Urgent Care and has been helping state governments set them up.
The urgent care clinic availability in New Zealand reduces presentations to emergency department by 25 to 33%.
Medical groups have renewed their push for the Medicare rebate for GPs to be increased, which they say would allow doctors to spend more time with patients. Doctors receive a higher rebate for shorter appointments, less for longer appointments per minute.
We need to have longer appointments with our patients to sort out the level of complexity and chronic disease that goes on. So at the moment, it values pushing patients through very quickly. If you can, under 6 minutes, and we know that's in terms of the doctor's point of view, that's a better way to practice medicine from an income point of view, but it's actually not a good way, not a good quality standard.
At Harris Park in Sydney's West, practice manager Rosemary Coluccio runs a tight ship to keep this bulk billing clinic afloat.
It is hard to run a bulk billing practice because there's not a lot of incentive for the doctors. On a busy day, they'll probably be seeing between 40 and 60 patients a day. With the 5 visits that Medicare give out to each chronic ill patient is not sufficient, because they may need 10 visits or 12 visits. They may need to see a dietitian, they may need to see the podiatrist. The doctors have got limitations on what they can do and what they cannot do.
Part of the solution is already in the government's hands, according to the AMA. On the eve of the budget, the government released its final primary healthcare 10-year plan, a wide-ranging report setting out the case for reform. The government consulted more than 100 organisations over 2 years. And yet, the AMA says the government isn't spending enough on the plan.
We think that something in the order of $1 billion will be needed to properly fund the reforms in general practice that are needed.
The government maintains it's already spent $1.7 billion on new primary health care investments since 2020. Medical groups, as well as the states and territories, want the federal government to increase its share of funding with the states from a 45-50 split to 50-50.
And that will mean more beds for patients, it'll mean more operations, it'll mean more staff to look after the health needs of our community.
On the dental front, public system waiting lists have blown out to up to 3 years, and the Greens are pushing for dental to be included in Medicare to make it more affordable for vulnerable Australians.
The Greens policy has been costed at $77 billion. It's very aspirational, it's very expensive. That's why the ADA believes that more incremental approaches to increasing access to dental care is more feasible and more realistic.
These images, collected by an Adelaide dental clinic, show some of the worst cases among the elderly.
The first thing I do is brush their teeth because I cannot even see their teeth. The teeth are simply covered with plaque and food debris. Avoidable problems, if not actioned now, then they will end up in emergency departments.
This is an urgent issue. We have a report from the Royal Commission that has clearly identified the extent of the problem. Government needs to act now.
As polling day nears, time is running out for the major parties to pitch their bold vision for Australia's health system to voters, and some believe it can't come soon enough.
I would like to see all the politicians, whatever colour they are, blue, red, green or yellow, get together and agree on a health policy for the country.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.